Our speaker tonight is Patrick Kennedy. Patrick was born in St. John's. His father was an RAF crew member from World War II. He was from Harbour, Maine and Conception Bay, and his mother was a British nursing sister. Pat holds a Bachelor of Arts, a master's degree from Memorial, as well as an LLB from the University of New Brunswick and an LLM from the University of London. Pat has also completed graduate courses in public health and epidemiology from Memorial University's med school, and as a historian, he's focused on the medical history of this province. Pat has also had an extensive career. Not only, of course, was he a long-standing practicing lawyer, as well as serving the judiciary, he has also held numerous executive positions, both at national and provincial level, including at the Canadian Paraplegic Association and the College of Vocational Rehabilitation Professionals. Pat was also a president of the Canadian Association of Provincial Court Judges, and very notably for us, he was, of course, our current past president of the Newfoundland and Labrador Historical Society and had a wonderful tenure and was a great mentor as well to myself. And as he will remark, as a child of a former National Convention member, he has a profound interest in the history of pre-Confederation Newfoundland and Labrador. His talk tonight is entitled A Forgotten Decade, Reappraising Healthcare Delivery on the Island of Newfoundland in the 1920s. Pat today is going to give us a talk on the history of the healthcare system there at this time and to understand its development, both those misunderstandings about that history and in the context of course, that all-important document that has really shaped Newfoundland Labrador history, the Almary Report. Subsequent historians and politicians have noted uncritically often accepted the Almary Report, and in his lecture tonight, Pat's going to really take us through that and that type of narrative. And it is on that note that I'm going to turn it over to Pat and say a big thank you again for giving our first lecture for our fall series.
Okay, thank you for inviting me here tonight. And it's good to start the year off with a bang, you might say. This topic got my interest for several reasons. First of all, I read a lot of books on Newfoundland history, which tends to concentrate on politics, on economics, and on topics of that nature, whether teachers have written about teaching. But when I was reading the biographies and autobiographies of people like Robert Ecke, who was a doctor, American doctor up in Trinity, or Twillingate, I'm sorry, and Robert Olds, who was also at the same hospital in Notre Dame Bay, Memorial Hospital in Trinity, I said, there's nothing but negativity as regards what's going on. Now, they were positive about the people they were dealing with, but there was nothing there about the 1920s. Everything was 1930s. And then when you read Joey and a few other people, you realize that the 1920s history of medicine has, in a certain way, been forgotten. Although recently they're starting to bring it back to life again, especially the Grenfell group that has written several articles and books lately about Grenfell right up to the modern days. So, but I'm going to deal with the island of Newfoundland, not Labrador. Is there any Labradorians here? I'm sorry. But I'm just sticking out, let the Grenfell people who've done a fantastic job getting the history of Grenfell and Labrador as regards medical, modern medical, not the native population, just the modern medical aspect of it. So let's look at what's going on. The evidence that most people read, what I read when I was in college 50 plus years ago, was that everything before Confederation was horrible. Everyone was starving to death. And a lot of the historians go back to Amalry, was mentioned as being his report, which was written in 1933, was the basis of the British government determining that we needed a commission government. It was on information that Amalry put together. Amalry statistics were basically everything that was going on in 1933 and 34. Those of you who remember, in 1933 and 34, Newfoundland was in the depths of a depression. Huge number of people were unemployed. There was no money for anything. People were living on 6 cents a day. But that's what Amory had in his report. So it's fair to say that the 1920s, and he never mentioned the 1920s, by the way, in his report, very, very briefly, although in one topic, which I'll get to. So the decade of the 1920s, in some respects, is a blind spot, bookended by World War I and by the Depression, and some of the social and economic effects of both. Now, many sources of history of the island of Newfoundland appear to start with the analysis that Amory put in his report, 1933-34, using statistics that were very negative. Amory was accepted, commission government came. Things did improve somewhat under commission government, but there was never the money to develop what had been planned in the 1920s. In 1946, R.A. Mackay, published Newfoundland Economic, Diplomatic and Strategic Studies, 1946. Mackay was a Canadian civil servant who was working for Canada on the pro-Confederation side. And he wrote a book which basically says, I want to tell Newfoundlanders everything so they can make the right choice. And guess what he did? He relied on everything negative that came out of Amory. Everything. The result being, that's what people believed. Even the reports that went to the National Convention, a lot of it was based on Amory and what happened in the 1930s and 40s. And of course, after Amory, Smallwood arrived on the scene. Even though in 1930, Smallwood said that the health of Newfoundlanders was really great, it was a healthy place to live. By 1946, the health of Newfoundlanders was horrible. Absolutely horrible. It was, you don't want to go back to that? You don't want to go back to that, so join Canada, which is exactly what Mackay wrote his book for. Now, all three writers had a vested interest in presenting facts and statistics to conform with their political agendas. Amory to support the appointment of commission government, Mackay and Smallwood to support confederation with Canada, and to emphasize the improvements to healthcare and facilities during both Smallwood's administration and how it would be better under Canada. Now, unfortunately, Amory's legacy, and Mackay and Smallwood, eventually eclipsed much of the historical reality that occurred in the 1920s because they didn't address the 1920s. Hence, it appears that the 1920s in history appeared to have been subsumed into the 1930s. And everyone thought what was going on in the 1920s was the same as the mid-1930s. It wasn't. And it's interesting that even though I've castigated Amory, it's ironic that in his report, little place in his report, Amory, in spite of creating a negative picture of what was going on in the 1930s, if you read it in detail, I'm ratting on here and I'm forgetting to do the slides. Okay, those are the three. Amory's selective negative statistics were relied upon by Mackay and Smallwood. However, if you look at the detail in Amory's report, he did give an accurate depiction of the state of healthcare in the 1920s, which nobody seemed to pick up. When he said, we have already indicated elsewhere a serious apprehension that the health of the people, formerly good, notice that word, formerly good, is in many parts of the island being seriously undermined by the conditions which they are now called upon to endure after 4 successive years of adversity. In other words, he recognized that there was good in the background, but it wasn't, he didn't emphasize it. It was almost a side comment because it didn't comply with what he was trying to do. Now, we know why Emery did this, and we know why McKay and Smallwood followed after him. But why? Maura Handrigan, in 2010, addressing what reason she thought was the reason for this, why the 1920s was forgotten, said that Emery's work seemed to institutionalize myths about Newfoundland that had clearly begun to take root because of the terrible depression that was going on. Those Newfoundlanders who allowed themselves to be called Newfies took Emery's bell and ran with it, whether they realized it or not. Connor, who is I believe, the Clinch Professor of Medical Humanities and History of Medicine here at Memorial, and has been so, I think, since 2004, recently in 2015 referred to the negative views of historians who later promulgated a portrait of extreme deprivation for the whole island for its entire history before Confederation. Again, going back to the Three Musketeers, you might say. Even as late as 1921, it was described by a historian as a period of demoralization. And another one as despair. So that's what appears to be written until fairly recently. And those that did identify healthcare issues tended to minimize the advances that occurred. And I will be addressing some of these later. Now, I submit that the healthcare system of the island of Newfoundland in the 1920s was surprisingly better developed and organized than is generally assumed. The healthcare service and facilities that existed and evolved in the 1920s were not intrinsically unsatisfactory or inefficient, as suggested by much Newfoundland historiography. It is time to retire the historical narrative of the period before Confederation as regards the healthcare of Newfoundland, the island of Newfoundland in 1920, and present a more accurate description of what was occurring in the historical context of the time. It was in reality a time of positive change, reform, and general improvement of healthcare, health services, and facilities on the island. I hope to show that a developing and recognizable health system involving the interaction of many stakeholders and factors during a time of economic and social transition, contrary to the gloom set out of many historical sources to date, it will hopefully show that what started as a disparate and scattered health service and facilities evolved during the decade to the point that it can be recognized as constituting an identifiable form, a system that recognizably was evolving, but still in a rudimentary state, which roughly matched what society and economics at the time was capable of delivering. Now, how I did this was using primary and secondary sources available, provincial archives, the rooms, the Center for Newfoundland Studies, special collections, one library, especially those of the NONIA, Newfoundland Outport Nursing Industrial Association, and the Joyce Nevitt collections. And using the annual government statistic and Journal of the House Assembly, which give the births, marriages, and deaths for each year of the 1920s, and some other valuable information too. The annual reports of the International Grenfell Association, Child Welfare Association, Notre Dame Memorial Hospital, and St. John's General Hospital. Histories of education, railways, migration, and communications, and the medical register of the St. John's General Hospital, 1919 to 31, which gives us a really good overview of disease and conditions and the geographical origins of patients that were treated at the General Hospital, medical patients. Now, during this period of time, just to give you basic background on the medical register, it's a basic medical register, the type used in the early 20th century. It included 2,605 patients who were admitted to the medical wards of the hospital, being a high of 19.5 and a low of 11.5% of those total admissions to the hospital. So it wasn't all the patients, it was just the medical patients. But we have 2,605, of whom 2,549 were usable for the purpose of analysis, which we entered into an SPS program and analyzed. And just to tell you the type of information that's available in the register, first of all, it's very private because it contains the names of the people. So in order to get access to it, I had to sell my soul. I had to sign an agreement that I wouldn't copy any of it, and I wouldn't divulge anything but the basic information from it. In fact, if you want to get access to it, you've got to get special permission. Now, every entry, there's an entry, a line made for each patient that has the date of admission, the numeric number, journal number for the hospital, the numeric hospital registration number, the full name and gender, age, place of residence or origin, the referring, which could be done by either a physician or a nurse at that time, the number of days in the hospital, discharge date, the disease and condition were suffered, the result, and any extra information like referral to other medical institutions. Further, to get further analysis, we took all the patients at the medical register to find out where they were from. We broke them into 25 different areas on the island. The reason we had to break it up this way instead of using electoral districts was the electoral districts changed in 1925. And we had to do a base which was the same right the way through. Unfortunately, some previous research in historical nature in this province didn't recognize that fact. And they've actually used the districts which changed in size, and hence some of their research is questionable, but I'm not going to name any particular names. Anyway, in addition to that, we broke down all the diseases and conditions into there's 15, I think, was 15, I think, total of the, yeah, we'll get to that now in a second. 15 different areas in the province. St. John's was number 1. Number 2 was the area around St. John's. And the other, all areas 2 were the Avalon Peninsula. 3 is Burin Peninsula and Placentia Bay. 4 is Bonavista. 5 is the Bonavista, well, north of Bonavista up to Cape Friels. Then Friels across, and you'll see it right the way across the island. 7 is the west coast. The south coast is split up into 2. We also broke down all the conditions that the people were suffering from into 25 different conditions, whether it be heart, whether it be respiratory, into dietary, brain problems, infectious diseases. We broke them all down to 25. Now, I haven't got them all written here because it'd be just too many to go through. But anyway, once we had all this information, we had to consider what were the circumstances surrounding healthcare in Newfoundland at that particular time. World War I, there'd been significant economic growth, but that had ended. The country was just recovering from the effects of the war and the Spanish flu. The economic circumstances had deteriorated to a point that there was a mini depression in the 1920s, and the political situation was in a state of flux. We think of the Hollis Walker report and the problems that occurred to Monroe being elected in 1924. But things were happening in spite of what the political historians say. They were happening in the medical and social area. During the First World War, a social movement arose, not only in Newfoundland, but this happened in Europe as a result of the war. This movement typically came from the social elite and the professionals. In St. John's, it was the social elite, whether the governor's wife, whether it be the businessmen, people of this nature, and the doctors. It was done initially to support the soldiers, but then it became increasingly a social consciousness as to the needs of the poor and the sick in the country. Now, Unfortunately, part of this movement, which by the way comes from Stoicism actually, and from the 19th century Victorian times where it came from, part of this movement was called self-help philosophy. Basically, what that means, people have an inherent power to shape their own lives and improve themselves in their circumstances. So if they're able to do that, we're not going to give them anything. In other words, if you're poor, we'll help you. But if you're earning anything above a certain amount, we're not going to do anything for you. There was no MCP. Rich pay for their own. The government did look after the poor, but that's will come later on. They only gave what was absolutely necessary to the poor and the sick. So what happened was that much of the growth in facilities and a lot of the growth actually in the doctors, nurses, whatever it is, came from the charitable sector and the corporate sector and organizations. But just to tell you the type of person that you're dealing with, who was involved, who got involved at that time, I'll just tell you the background. Oh. Nope. I'm afraid one of the slides is missing. I had a nice picture there of two people who were involved very heavily in this social consciousness movement, you might say. One of them was Harris Musdell. Some of you, I'm sure, have heard of him. He's an interesting person. He was originally born in Bay Robson. He was a teacher originally and a newspaper publisher. Then he went back to medical school in Toronto and as a journalist at the same time. Graduated with a medical degree from Toronto in 1911 and came back to Newfoundland, practiced on the West Coast, I think at Woody Point for a couple of years, and then got in with Squires and became the publisher of Squires' newspaper. And in fact, he followed Squires all the way up through. It's one of the reasons he was so influential. He served on the Legislative Council in the early 1920s until he was elected to the legislature in 1926 of Fortune Bay and remained there right till the Commission government came into force. He was also minister in the government of Squires, Minister without portfolio, was previously a member of the governance board of St. John General Hospital, member of the Lunacy, that's what they called it, commission, and oversaw the lunatic asylum, as they called it. Please don't, I'm not taking that in a derogatory way, but that's what it was called in those days, the Waterford Hospital. He'd written a 1921 report, actually, on that hospital, recommending some major changes. He got an MD in public health and hygiene, a PhD, basically, you call it an MD then, from the University of Toronto. But one of the most important things was his political power, but the fact that he had traveled very widely through Canada, the United States, and Scotland and England under a grant from the Rockefeller Foundation to view public health organizations and healthcare in those places. And those places profoundly influenced what he observed and what he was later reflected in many of the recommendations of the commission which he chaired in 1930 on health and welfare, which I will get into later. But the other thing is he was a member of the American Canadian Public Health Association. He was, these published journals, and there's all kinds of new legislation across the world concerning health at that day. For instance, the Shepard-Travers Act and the Federal Board of Maternity and Infant Hygiene, 1922 in the States, addressing children's issues. The creation of the Ontario Education Division, 1924, led to the spread of public health-related information. The groundbreaking Montreal Health Survey of 1929, which called the reorganization of the Quebec of the Department of Health and Welfare, and was available in that many of the issues that they addressed and were later put into the recommendations of the 1930 report came from that report in Montreal. He also had reference to the British Royal Commissions, which I would note were strongly supportive of the self-help philosophy in health, which remained even with Mausdell right up till the 1930s, when he was the father, you might say, of the cottage hospital system. Heidi Coombs-Thorne describes Mausdell as having accumulated a wealth of knowledge on the healthcare situation in Newfoundland. And he was, I would say, the leading force in changes to health services and facilities in Newfoundland in the 1920s. Comes up right throughout this whole talk. It's important that he was appointed the chairman of the Board of Health and the Royal Commission at the same time. I noted a salary of $4,000 a year. He was a friend of Sir Richard Squires, remember, which I think was the highest salary other than the governor in the province at that particular time. Another person who was involved was Clooney McPherson. I'm sure most of you have heard of him. He was a visiting physician at the St. John's General Hospital, and he practiced in 1904. He'd been involved in innumerable aspects of healthcare, a doctor with the IGA, a medical researcher, contributed to epidemiological studies, head and long-standing director of the Newfoundland Medical Association, a decorated war veteran, was involved in the first gas mask, founder of St. John Ambulance, and a member of innumerable voluntary organizations relating to health. It was said of McPherson when he died that there was scarcely a benevolent or utilitarian movement in Newfoundland in the last 60 years that he did not support or labor in totality without ostentation. So these are the type of people who are behind this movement. So that's the power of knowledge. And these are in a society in Newfoundland, which there wasn't a lot of knowledge in this field. But they took the facts and ran with the facts, not like Amory supporters who took the other stuff and ran the other way. Now, so again, I asked what was going on as regards health facilities and services in Newfoundland at that particular time. As I said, World War II had ended, veterans were returning, the mini depression had occurred, and the social movement had started. There we have McPherson and Mausdell. I'm sorry about that. That's the younger, when they were in younger years. I think that's the actual graduation picture of Clooney McPherson, and Mausdell was probably in his early 20s at the same time. Now, hospitals are a critical part of any health system. In fact, some people call them the cathedrals of healthcare. While Newfoundland, compared to Canada, was late in starting any program of systematic hospital building, the period of the 1920s is notable for an acceleration in the growth of hospital facilities in both St. John's and on the island. Despite its financial limitations, the debt was rising. The government of Newfoundland did operate and expand facilities in St. John's. A 52-bed sanatorium was opened in 1917 and increased to 111 beds in 1921. This was the only sanatorium in the country and accepted patients from across the island. The government also built several military-related facilities, including the Sudbury Hospital, 28-bed facility, which opened in 1920 to serve military veterans and civilian patients. This was especially for providing rehabilitation treatments and physical therapy, the first of its type in Newfoundland. And they also gave after discharge care, which was minimal prior to that. In 1921 alone, it provided medical and surgical treatments to inpatients and outpatients. And of 672 patients treated in 1926, that's how many that little hospital in 1 year treated. Unfortunately, for financial reasons, it was closed down as a hospital in 1928, I think, but it was then made into a medical clinic, the public health office, and the location of the government laboratory, so the space was not wasted. In 1920, the St. John's General Hospital had 120 beds, was the only general hospital in the country providing medical and surgical care except a small International Grenfell Hospital at St. Anthony with 25 beds. Notice I said General Hospital. Practically everyone from the outposts came for treatment at St. John's, except those would have gone to St. Anthony with Grenfell and some of the people in Central. The mandate of the St. John General Hospital was to provide health care to the whole island. During the 1920s, it's quite clear that St. John's General Hospital was suffering from severe overcrowding in the early 20s. And it was often difficult to find accommodation for those seeking admission. In fact, they were even put in boarding houses to wait to be admitted. It wasn't until 1921 that the St. John's General Hospital accepted children. And very few maternity cases were accepted in emergency situations. A children's ward was opened in 1921 to take the influx of children from the closing of several small private children's hospitals which existed in the 1920s. Nurse Hiscock had an emergency hospital, I believe, in the children's hospital, and so Dr. Fraser had one too. The number of patients at St. John's General Hospital increased from 1,203 in 1920 to 1,749 in 1929-30, a 31.2% increase. Also on the grounds of the General Hospital were a fever hospital of 50 beds and a convalescent home of 44 beds. The government also operated a poor asylum of 108 beds as a poorhouse, which was renovated and enlarged in 1928 to become an infirmary for aged and the infirm. The inmates, that's what they used to call them, came from every area of the country. That poor asylum, again, with the influence of Harris Mosdell, was increased to 160 beds in 1930. It's interesting that when he reorganized it, what he did was he said, listen, if you could work or you can be looked after at home, we're not interested in you. We're interested in the people who are really poor, really infirm. The rest of you, go. That's how strict this self-help was. We will help you if you need it. A mental hospital also existed in the West End, having 315 patients in 1920, increasing to 400 by 1929. Now, in addition to government institutions, there was a significant increase in the number of hospital beds in St. John's during the 1920s. In 1922, the Roman Catholic Church, through the Congregation Sisters of Mercy, converted a home for working girls into a small 23-bed private maternity and general service hospital. It provided medical and surgical service with the assistance of 12 local doctors and 4 nurses, increasing later in the 1920s. An X-ray department was opened in 29, and the number of nurses increased to 8. It was a private hospital owned by the Sisters, Congregation of Mercy, and it provided private patients, but it also accepted government patients if the government paid them services to be provided by the hospital. This later became St. Clair's Hospital in the 1930s. The Salvation Army operated a small home for young mothers and maternity patients in St. John's. The Salvation Army was involved right across Canada in building hospitals. Not only the Salvation Army, but the Catholic Church. You think of Montreal, the Grey Nuns. And in fact, in 1920, I think the statistics are that 75% of hospitals in Canada were actually owned by religious orders or charitable organizations, not the governments. The governments couldn't afford it. So in the early 1920s, local physicians and the local Salvation Army, who ran a small maternity hospital in this small hospital for young mothers, saw the need that they had to build a modern hospital, maternity hospital. In 23, I don't know if any of you noticed the picture on the, let's see, now that's a sanatorium in 1921. That's how big it was. That was St. Clair's. It was opened in 1922. Any Grace graduates here? That's your original hospital. Yeah, that's the main entrance. So this was built, and they raised funds and built it. It was originally a 22-bed maternity hospital on one floor containing baby bassinets. It had an 18-month maternity nursing program, which had not existed in Newfoundland prior to 1924. They graduated in the field in 1926. But there was a tremendous increase in the demand for general medical and surgical patients because St. John's General Hospital was just too darn busy. And in 1925, they increased the beds to 55 beds, with the addition of surgical X-ray department, pediatric ward, and 26 beds, and a laboratory. In 1929, it became the Grace General Hospital and further enlarged to 96 beds, containing maternity, medical, surgical, and children's ward and nursery beds. It also, in 1928, started a 3-year nursing program. In 1928-29, it admitted 1,416 patients, 22,000 hospital days, with an average stay of 15 days. It carried out 1,040 operations. The government reserved 8 beds in the hospital for 4 people that they were going to pay for. So we have St. Clair's, we have the Grace. We have the extension of the Poor Asylum. We have the extension of the St. Clair's, the Great, I'm sorry, I'm not going to repeat myself, okay? But it wasn't only in St. John's that everything increased. The IGA constructed a new 60-bed full-service hospital in St. Anthony in 1927, replacing the 25-bed facility built in 1905. It increased the annual number of patients from 340 in 25-26 to 560 in 1930. The number of outpatients increasing from 2,050 to 3,001 in the same period. In addition to that, IGA had nursing stations on the Northern Peninsula. But when you look at the total number of people, I'm not studying IGA as such, but they had 7 doctors, 14 to 34 nurses at various times, plus visiting physicians, dentists, teachers, social workers. It was a full medical system. And they had nursing stations in Flowers Cove, Englee, and Port Saunders, were actually run by them. It actually had a full staff of 105 people, I think in 1928. So it was quite a big organization. And I note that 90% of them weren't Newfoundlanders. They were from the States and the UK. There were a few Newfoundlanders, but the Newfoundlanders basically were nurses' aides, cooks, and everything of that nature. The educated ones were from outside of Newfoundland. But that's something that's I'll address later on. Now, Newfoundland has a history of corporations or companies opening hospitals to provide care for employees. Notre Dame Bay, that's the New St. Anthony Hospital in 1926. That's the Twillingate Hospital in 1926, which I will get to now in a minute. But we have a history of companies opening hospitals. Newman and Company had a doctor down the south coast until they closed out in 1903, and he moved off. Dr. Fitzgerald moved, I think, to Pools Harbor and became the doctor there. In fact, anyone would have read the book written by his son, The Albatross, would understand where that comes from, but he started there. But the Baver Peninsula in the area of Notre Dame was very rich in mineral assets. And as early as the 1880s, small hospitals were built at Betts Cove. When that ore body ran out, they moved to Tilt Cove, then Pilley's Island, and which had a 15-bed hospital. And in 1925, that Pilley's Island Hospital was replaced by this, the Notre Dame Bay Memorial Hospital. In 1924, it only admitted 290 patients when it was first opened, but by 1928, that increased to 482 and 1,500 outpatients. A new wing was added in March 31, which is slightly outside this period, putting it up to 90 beds, which is what this one is. I couldn't find a picture of the earlier one. The hospital employed full-time nurses, and at least one permanent doctor. I would point out that the Willingate Hospital was the first hospital in Newfoundland to be accredited by the American College of Surgeons in 1927. That's the standard that was around in 1927, followed by the IGA Hospital at St. Anthony, I think in 1929. The General wasn't accredited until many years later. That's the level of care that they had in those two hospitals, which weren't there in 1920. Just an example also of how the local people, Henry Crow, who was a local businessman operating a forestry business, people might know the name, in White Bay, opened a small hospital in Hampton with a nurse and a doctor in 1927 to treat the people who worked for him. It's interesting that one of the first doctors there was Dr. O'Regan, who later became a GP here in St. John's, and his grandson lives on my street. So it's a small world. A small 9-bed hospital was erected by the Anglo Development Company in 1909 in Grand Falls. It had 2 full-time doctors and several nurses. They also operated a small hospital at Middletown. In 1928, the Buckens Mine opened, and the American Smelting Refinery opened a 10-bed hospital to provide medical services to its employees. So the companies provided the doctors and the hospitals. It should also be noted that the first industrial nurse was employed by Union Telegraph Company in 1921. Everything was happening at that time, much to Amarie's distress. Now, no hospital existed on the west coast of Newfoundland until 1925. A 12-bed hospital was built at Deer Lake, and a 25-bed full-service hospital was built in Corner Brook. These provided health services not only for the employees, but also for people of the whole west coast and part of the south coast of Newfoundland. Prior to these 2 hospitals opening, west coast patients used to go to St. John's for treatment by train. The opening of the pulp and paper mill in Corner Brook led to a significant increase in population. And also, as doctors are attracted to numerous people who have money, I don't mean that in a bad way, the number of doctors in Corner Brook increased from 4 in 22 to 8 in 23 to 10 in 1926. And in 1927, during an outbreak of typhoid in the area in Corner Brook, the Newfoundland Hospital contracted the Deer Lake Hospital to provide care for the patients involved and paid the full cost of services rendered. I'll be mentioning that later on too if I got a chance to get to it. A small 5-bed hospital was built in 1889 at Grand Bank. By 1912, it needed to be rebuilt and was treating 94 patients in 1915. However, by the early 1920s, it really came under reduced circumstances. The doctor down there, poor old Dr. McDonald, was appointed a magistrate with a salary, and he lost interest in the hospital. It was owned by the community, so he wasn't interested. The community kind of fell apart. And unfortunately, even when Dr. Burke went there, most of you would know him, he was around till the 1960s down in Grand Bank, he couldn't get into the hospital, or he wasn't allowed to use it, you might say, even though Dr. McDonald continued getting his $100 a year from the government for running it. Anyway, by the late 1920s, it became so bad that it wouldn't even take patients. So the government undertook an investigation. They sent the Secretary of the Board of Health down, who went on to the TB boat with Dr. Randall, which did a regular circuit down that area every summer. And he did an investigation into the hospital. I'll get into that a bit later on, but the hospital basically was rebuilt at a considerable expense to the government. They appointed a new local board to run it, and Dr. Burke took it over. And it became a very busy, small hospital. In one 3-month period, in 1930-31, it treated 134 patients. And it had been increased to 8 beds. By that time also, They had hired a Nonia nurse down there. Now, all this hospital building created all these hospitals, nodes, you might say, of hospitals, where people from the contiguous area went for services. If you look at this, the color doesn't come out very well, unfortunately. Get around here. These are the two on the west coast that were built. They service this area. And I got this information from not only the hospitals themselves, but also doing some research into the Board of Health files at the archives. That's the St. Anthony IGA. That's Millertown, Buckens, and Grand Falls. Up there on the dot up there is a Twillygate Hospital. There's your Grand Bank Hospital, and there are the hospitals in St. John's. Now, there were two small hospitals too in Bonavista and in Harbour Grace, but they don't seem to be very active in the 1920s. When you put all this together as regards hospitals, the cathedrals of healthcare, the number of hospital beds in St. John's increased 718 in 1920 to 1,034 in 1930, 30% increase. In the areas outside the Avalon Peninsula in St. John's, the number of beds increased from 54 to 181, an increase of 127 or 335%. This was a significant increase anywhere. But it was also the same situation was happening in Canada at that time and in the States. There was a huge increase in the construction of hospitals at that time. And as you can see from this, they became nodes where the people in those areas used those hospitals. Now, there are other institutions that grew exponentially in the 1920s and provided tremendous service to the population of the island. Nonia, originally founded in 1921 by Governor Harris's wife and other leading social persons. It was a contemporary social reform to provide nursing services to the rural areas of the island not covered by doctors. I think Nurse Hiscock did a trip around the island and came back and talked to Governor Harris about Lady Harris, who then went out and looked herself and realized how bad it was, especially when they got around White Bay, where there was absolutely no government services at that time, or no health services. So in 1921, they set up an organization, not Nonia, but the Outport Nursing Association, who hired 6 nurses from England and sent them to 6 locations in Newfoundland. Unfortunately, again, the color doesn't come out really well here, but there were 6, can't really reach it here now, but that's, some of you might have heard of Nurse Myra Bennett. She was up there. There were others, Rose Blanche, Bogo, Greats Cove, and I think Southport. I'm not sure, I can't remember the exact name. And their office was in St. John's. They were all contracted for 2 years. But after 2 years, 4 of them had left, 1 of them had married. There wasn't much left because if you got married, you couldn't work in those days. So Lady Harris got back together and they decided to form the Newfoundland Outport Nursing Association. Now this was designed, as I said, to put nurses out in areas that weren't covered by doctors. However, it too was affected by self-help in that they set up a industrial side, basically women weaving. You got Nonia today. It's the survivor of that. They provided the money to run the nurses' station. And the government, who saw the value of it, put in 25% of the cost. So the government got away cheap. Now, over the period of from 1924 to 1931, Nonia did was in 25 different communities in Newfoundland. Now, it's hard to see this, but just to see where they were: Roast Blanche, Joe Bart's Arm, Hensarber, Garnish, Port Saunders, Bombay, Pooch Cove, Jackson's Arm, Coachman Cove, right through the whole island, providing services that were just not there before. There was quite a few of them. 25, I think, is what although there's an argument, some people say it's 24. Looking at their archives, it looks like 25. But when you look at the statistics that they treated, the patients and the people they actually did work for, it's phenomenal. In 1924-25, they did 9,230. 25-26, 16,443. And it went up to 45,748 in 1929-30. It was growing really fast. Then money started to get less. They weren't making as much money in the industrial side as they were before, so they started to close out stations. 30, 31, 29, 32. By 1932, they were down to 16,609. We don't have the stats for 1933 and 34, but in 1934, there were only 4 left, and the government took them over. That is 212,000 people. Population of Newfoundland was only 280,000 at that time. They were there at 627 deaths and 1,454 births. There's a staggering amount of people. And yet one of the historians said a minor nursing service was developed in the 1920s and failed in the 1930s. Now, what were the effects of the government policy of economy of services on the operation of hospitals, other institutions, and organizations? The government acknowledged that and realized pragmatically that subsidization was required to provide the necessary health services and facilities to the population of the country that the government just could not afford. This was not common to Newfoundland, it was common everywhere. So they got involved with other stakeholders who were providing the health services. The government figured out that by providing subsidies, they ensured that healthcare was delivered and that they wouldn't have to provide it, except for a subsidized amount. But they did provide it still for the poor and the sick. Now, just out of interest's sake, this is the amount of subsidies that were paid to various institutions in Newfoundland by the government, going from 6,900 in 1920 up to 51,700 in 30-31. After that, it dropped right away. Again, this is significant. You'll note that individually, the Grenfell hospitals down here received individual amounts. But in 1927-28, they got a lump sum of $15,000, which was a lot of money in those days as a subsidy. You look at the Notre Dame Bay, 28,000, 30-31. Grace didn't have a lot because they were a private hospital, but there were amounts paid out to other Salvation Army institutions at the time. It basically covered all the hospitals and the institution providing health care in Newfoundland. They provided a subsidy to it. They didn't do nothing, as some people say. I think Overton said in 1994, in rural areas, there was virtually no change. There was no real sign that the state was prepared to take more active role in promoting health. Now, Overton is a great historian. I'm not saying he's the one who really was the father of self-help in Newfoundland as regards studying it, but he didn't really, he only looked at the social aspect of the 1920s, not the actual medical health side of it. As regards, just out of interest, again, sake for just things that are coming to my mind as I'm going through this, this originally was 160 pages, 400 footnotes, and 44 graphs. And I had to put it down to this for 45 minutes. Everything is just churning. I want to say more and more, but I know it's not right to get to it. But anyway, other things that I'll give you another example of how the government was involved. I've mentioned the typhoid outbreak in Corner Brook in England in 1927. But there was also smallpox outbreak in Newfoundland 1915 to 1920. In that smallpox outbreak, which a paper was written on that by Mary Bishop Sterling. And she identified in that the government was cheap. They didn't want to spend any money. And they were paying the doctors per service, and it was costing them too much money. So by not paying out enough, they dragged it out. It was finding not until 1920 that the smallpox epidemic in Conception Bay and Belle Island was actually brought under control. But by 1927, things had changed tremendously. The government's approach to it. Again, Marsdell, I think, was the main reason for this. There was an outbreak of typhoid in Corner Brook as a result of water, bad water. The area around the town was developed out of control, tar paper shacks and God knows what else. And typhoid got in. There was another outbreak the same year in Englee. As soon as the government heard by telegraph of the outbreak in Corner Brook, they sent a doctor out and a nurse. They hired the Deer Lake Hospital. They paid all the costs of that hospital and all the vaccines and all the treatment without question, because they knew that they had to control it. It's a different attitude than before. It was a professional attitude. In Englee, another outbreak, immediately about being told that this had broken out, they contacted Dr. Curtis in St. Anthony and said, "You're the closest, deal with it for us." Sure enough, they sent down doctors and nurses. The government sent up vaccines and everything else to them, and it was brought under control just like that. They acted instantly. That's not doing nothing. That's how things changed in the 1920s. The government actually got involved heavily in providing a service they knew had to be provided. Another aspect is the appointment of medical officer of health. It's very hard for a doctor in Newfoundland, a rural doctor in Newfoundland, to make a living. You know, fishermen have good years and bad years. There were only a limited number of businessmen. You had to make a living. So they were losing doctors. So the government said, well, one way to solve this, not only it'll stop losing the doctors, but we'll also be able to provide treatment, free treatment, to the poor and the sick in the certain areas. We'll appoint medical officer of health and pay them a salary. That will allow the doctors to stay there on a salary, so they wouldn't lose the doctors because there's no money in the community. And this was, again, they did this right through the island. There were 15, I think, or 16 medical officers of health appointed in rural areas. I also note what they did in the rural areas is the Grand Bank Hospital reconstruction. I'm not going to go into that in any detail. I was going to, but I just don't have time. Now, another thing that was going on is health-related legislation started to be passed in Newfoundland. An act to prevent venereal disease, the Venereal Disease Act. I believe it was 1921, if I'm not mistaken. There'd been a huge outbreak in Europe of venereal disease during the war, the soldiers. So the British decided that they were going to set up a program Newfoundland adopted it wholeheartedly. This involved the treatment of people with venereal disease, providing them with tests. First Wasserman test actually for syphilis in Newfoundland was in 1921. They were all done at the government laboratory. It also, unfortunately, was very punitive in that it caused problems for anyone that had a venereal disease, basically couldn't work unless they reported it. There were some pretty strict conditions attached to it. But it was legislation that came from outside, from Britain, the mother country, and was adopted, as other places in Canada had done. It's interesting that if you read Beery's article on venereal disease in Newfoundland, you wouldn't think that anything occurred prior to 1931 when a new act, when the 1931 Health and Welfare Act was passed. That Health and Welfare Act in 1931 merely adopted what had been done in 1921 and made some changes to make it less punitive. But when he looked at it, there he started in 1931, and you wouldn't think there was anything there before. But that's not in fact the case.
Should I wait for questions?
Well, I appreciate it if you go, because I'm probably not going to be able to finish everything 180 anyway. Anyway, the tuberculosis and the Act to Regulate the Importation, Exportation, Manufacture. Again, this came out of a 1912 conference. And it was made actually part of the Versailles Treaty. That legislation be passed considering the importation, exportation, manufacture, sale, and use of opium and other dangerous drugs. It was if I go back to venereal disease, I'm sorry, it's coming into my head now. Venereal disease did exist in Newfoundland. And there are cases, several cases in I think it was 16 or 18 in the St. John's General Hospital medical records in the 1920s. So it did exist. So it wasn't just legislation that passed because of the sake of passing. There were people here suffering from those diseases. And I note that several of them were foreign seamen who were treated down at the hospital. And I note in one thing that they found that at least one of the cases that came as a result of the activities of foreign seamen. Anyway, the importation manufacture of opium, that was made part of the Versailles Treaty, and Newfoundland adopted the wording exactly from the Versailles Treaty. And there wasn't much of a problem with drugs at that time in Newfoundland, but it's an example of how Newfoundland was starting to realize that it was necessary to recognize all these international and national efforts to pass legislation to control health-related matters. The Tuberculosis Sanatorium and Sudbury Hospitals Act in 1922 joined all the hospitals in St. John's together under the General Hospital to have one place to deal with more efficiently, although in the government fiscal records, each one was dealt with separately. The Midwifery Act in 1921, after the war, there developed a midwives club. This was again started by the social elite because they realized that the people, the midwives, who were in many ways the backbone of health in many of the outpost communities of that time, needed further training. So they started a midwives club, a 3-month training program. By 1926, 60 people had graduated from that. And then in 1921, they professionalized midwifery by starting an act, by passing an act which covered it. They recognized how important it was, and they legislated to make sure that the people out there and the persons that were trained were able to do the job. This is no way detracting from the many, many midwives that were out there delivering hundreds of babies out in the rural areas. Next one's very interesting. An act relating to the establishment of water and sewage system in Cronenberg. Might be dry legislation, isn't it? But it's not. That came as a direct result of the outbreak of typhoid in Corner Brook in 1927. They realized something had to be done. So they created a corporation out in Corner Brook that regulated all construction and growth and made sure that they were all with proper water supplies and sanitation supplies. That was the first legislation in Newfoundland that gave power to any organization over what later became the municipality's right to govern all these areas. The Optometry Act, 1928, we were the last place in North America, I understand, to adopt that, but it professionalized optometry and recognized it. The pharmacy in Newfoundland was a 5-year program, I believe, but when Memorial opened up in 1925, they started to take courses at the university, and it was reduced to 4 years. You know, everything was going on. The Newfoundland Medical Association was founded in 1925 and brought in people from all across Canada and the States to give lectures to local doctors. The Board of Health Regulations, which basically governed health in the island, was taken over by Mosdell in the late 1920s and ran and was used as his way of getting the whole thing changed and developed. The one thing you should remember, and I don't have time to go into any detail, is the 1930 Royal Commission on Health and Public Charities, which later led to the Health and Public Welfare Act in 1931. That Royal Commission was opened in 1929. It was set up to investigate and make more efficient ways of saving government money in any facility or organization that dealt with the province of Newfoundland as regard, the country of Newfoundland as regards health. Any money spent, they looked at it. But it was designed to make things more efficient, but at the same time, save money for the government. The membership of that committee was Mosdell, Bradley, the Solicitor General from Bonavista, Vista, later involved in Confederation, Dr. Anderson, who was a surgeon at the General Hospital, and Cal, who was a businessman. They all had tremendous political connections. And a lot of the recommendations that came out of that, some of them were adopted right away. Many of the others they didn't have the money to adopt, but were later adopted by the commission government, cottage hospitals, when the government set up their own nursing service. This all came out of this Public Health and Charities Commission in 1930. Now, I've already mentioned Overton as to what he said. I've looked at the smallpox epidemic and the medical. Now, one thing that I haven't said much of, and try to avoid it to a certain degree, is health ecosystem. I'm going to go back. Health ecosystem, well, health affects and is affected by many, many different factors. In health today, you've heard of the social determinants of health. These are the factors or determinants which are used to determine the health of a population. And there are many different factors that affected health in Newfoundland in the 1920s. And these multitude of factors, you could select from them what was appropriate from the time. And in doing that, you can better understand the health of the population and how there was an integrated development of it. Now, I'm going to go back. To the definition of health ecosystem. It's the interrelationship of various factors that influence improvement and change. It recognizes that society is an organic, mutually dependent whole, which all parts of factors interact. There are many complex factors that affect the delivery of health. You can't just look at health. You've got to look at other factors that influence health. And when in the 1920s, what I did was I took several of the social determinants of health that I thought were appropriate, that I could find evidence of in the 1920s, and looked at them and see how they affected health or health affected them. And Schmidt and Satterspiel in 2017, who are proponents of this health ecosystem, said that from 1920 to 31, Newfoundland was a complex, increasingly interwoven and multifactorial society in a period of transition. Now, again, I avoided to a certain degree, but an important part of my research was to use some of these factors and study them as regards how they affected health. Some of these you might say, how are they connected to health? Railways, road networks, motor vehicles, coastal vehicles, and motorboats, wireless, telegraph, education, migration, laboratories. But every one of those is connected in an intricate way to health. Transportation. The railways transformed the island of Newfoundland to a certain degree in the early 20th century and late 19th century. The railway was refurbished in 1923 and connected over 100 communities or towns throughout the island to St. John's and to other areas of the province. In fact, the network of patients over the main railway lines, which you'll see there, right from Corner Brook right down through, and those are the branch lines to Bonavista, branch lines up to Lewisport, branch lines down to Passy, and around up to Greats Cove, and up the other side of Trinity Bay. All those were used in the 1920s. In fact, the number of patients, poor patients, coming from close to the railway line became so extensive at one point that the government caused an investigation as to why so many people around the railway lines were looking for help, because they had access by the railway lines. It allowed patients from icebound areas during the winter from the north coast to get into St. John's. The south coast was ice-free most of the time. The north coast was iced in. So what do? You try and get to the railway. We did a study of where the origin of patients were from the medical register. We did a study, and Alvin Sims did the research, did the analysis for me. Remember, Alvin was in the geography department. And we said, well, how many of the patients at the General Hospital in the medical register came from within 10 miles of a railway? How many were more than 10 miles? You'll see that the numbers went, 1903 is an anomaly. I think it was just entered the wrong way. There was only a few in 1919. But you notice it increased right up to 1930. Not a lot, but it was increasing. Greater than 10 miles also increased. Total within 10 miles was going down. Greater than 10 miles was going up. One of the reasons for this, we think, or I think, is because more people were using roads. They didn't have to use the railway anymore because there were a really good road system was being developed. The road network between 1925 and 28, the government spent $2 million on a road program. That's an enormous amount of money in those days in Newfoundland. This is on the Avalon Peninsula alone. There were over 1,000 miles of improved roads suitable for motor vehicles, and many towns now became connected to the highway system. This in itself allowed greater access, not only to people to go to health, but for the health to get to them. In 1930, the Nonian nurse down in St. Lawrence, Grand Bank, who was given a car as a reward for all the service she did during the tsunami, used her car around the whole southern Burin Peninsula for a whole summer. Couldn't do that before until those roads were built in the 1920s. The number of motor vehicles increased from 925 in 1925 to 2,500 in 1930. Number of trucks from 94 to 503. Again, the building of the roads, the vehicles allowed greater access. St. John's had its first motor ambulance in 1928 and expanded thereafter. You think of coastal vessels and motorboats. Well, how are they connected to health? Well, coastal vessels had established runs and were used to transport patients all across the south coast, northeast coast, and they were absolutely necessary to the health system, especially in areas where there was no railway and no road. The motorboats increased from 10 to 12,000 in 1918 to over 30,000 by 1930. Motorboats replaced wind-powered boats. You could now travel 24 hours a day, regardless of the wind. It was a tremendous change in our society. One doctor on Pilley's Island in the 1920s, before they moved to Twillingate, traveled 5,000 miles by motorboat that summer. When you read the Albatross, when it was sails, he just couldn't get out. But when he had the motor, he could go anywhere. If you got someone sick, you didn't have to wait for the wind to change on the south coast. You just went. That was a real big change. Just a connection to is the fishery. Placentia Bay Brown did a study of the fishery, which said when the motorboats came in, the fishermen moved way out, and they couldn't go there before because it was all wind. The wind was southwest wind during the summer. They couldn't get out. But the motorboats, down they went, and they fished in areas they couldn't fish before. This affected health quite substantially. How do wireless telegraph and telephone communications affect health? Well, telegraph system expanded in Newfoundland. By 1930, there were 9,000 miles of telegraph lines serving 246 telegraph offices, 65 radio stations, both private and commercial. The first commercial radio station was opened in 1924, the OWR, later expanded across the province. Or the same province. When I say province, I mean the country of Newfoundland. IGA built wireless stations in Labrador in 1924. Nonian nurses were provided free access to telegraph services and used it to communicate with doctors in St. John's or other hospitals when necessary. The government itself, in a paper, recognized the importance of wireless communication in 1924 to the spread of information as regards health. The telephone system expanded extensively in the 1920s. Over 50 communities were connected to telephone system in 1929 alone. A lot were on the Avalon and the company towns, but many smaller communities did obtain access to the telephone at that time. At Twillingate, it was noted actually that the patients would rather call a doctor than walk to the hospital. What a change. You didn't have to put grandmother in a sled or on a horse and take her to the hospital. You called the doctor and said, "What's wrong with grandmother?" Ecke and Oles mentioned this, but this was happening in the 1920s too. Now, this significant increase in communication was embraced by the healthcare system, and it went beyond just the basic help here and there. It was a significant increase in a person's ability to access health care and to get information as regards health care. That brings up education. Now, knowledge is a critical factor in the advancement and development of any society, including health. Education is intrinsically connected to the evolution of healthcare. In 1920, Newfoundland had neither a teacher training institution or a university. The Newfoundland government, however, did give priority to education through the 1920s. In 1916-17, it spent $436,000 on education. In 1930-31, $1,989,000. But because of the Depression, only 496 in 1932-33. So education was enormous. I know, time-wise, I'm getting to the point now where I gotta be quiet. Anyway, so I could go on for another 3 hours. But the important thing is this. I wish I could have told you more, but there's so much to tell that just very, very briefly. Migration. People say, well, how's migration affected? People moved in Newfoundland. Newfoundland were a migrating society. The population decreased in early 1920s when 20,000 people a year were leaving to the States. Emery says 200,000 Newfoundlanders actually left Newfoundland and were living in the States and Canada. This affected the rural population. There was tremendous internal movement. Where did the rural people move to? They moved to the industrial centers where the jobs were. Corner Brook's population went from 4,745 to 15,035, 290% increase. Grand Falls, 9,000 to 14,000. And these areas amounted to 5.4% of the population to 10.4% of the population. You didn't have to treat as many people because people were leaving the outports. Anyway, I could go on forever on this one, but anyway. We did an analysis of all the patients at the St. John's General Hospital in the medical thing. Actually, the analysis was actually that thick by the time we finished all the analysis of all the conditions. I'm not going to go into them in any great detail, but I will just say that the patients came from all over the country. This is where they all came from. Mostly Placentia Bay, the Northeast Coast, and St. John's, but they were from other areas. 73% from St. John's, and the rest going down. This was the disease they suffered from. Everything that would normally be suffered by a person at that time. This is the dietary. One aspect of dietary is that there were, just out of interest sake, there were 58 dietary admissions. 41 of them had beriberi. Mostly males, not females. Also, when you look at these stats, they said that gastritis and anemia is a woman's disease. That's what the papers say. But if you look at the stats here, actually, there's more men than women suffering from it at that time. So if you look at these stats, I think you said, well, maybe that could be the case in Ontario, maybe that could be the case in Nova Scotia. But if you look at the stats in Newfoundland, it's not the case. I could go into a lot more of this, but I'm not going to. One aspect that I should be mentioned is the heart conditions and cancer, very quickly. Have I got time?
We're at 1 o'clock.
Okay, all right. Heart conditions, there's Schmidt and Sattenspiel argue that there is a second epidemiological revolution or transition occurring between when you turn from a rural society into an industrial society. And one of the great health indicators is cancer and heart disease. They increase when you become more industrialized. When you look at the stats of the medical patients at St. John's General Hospital, you find that the number of heart patients increased in the 1920s. The number of cancer patients, although there weren't many in the medical wards, there were a lot showing in the stats for deaths in the government reports. They went up exponentially too in the 1920s. So Newfoundland was starting to see the effects of that industrialization, that change in their society. So the stats clearly showed that. Hospitals, everyone thought they were horrible places. You know, the cure rates and improve rates at the hospitals, St. John's was 86 and 87%. Notre Dame, 85 and 86, and Anthony, 85. Those are not mortuaries. Those are tremendous in cure and improve rates. That's what happened in the 1920s. You went to a hospital, you had a chance of being succeed, even without antibiotics. The cure rates were really high. There was good service. And once you got in there, it didn't matter if you were poor or rich, you got treated the same way. I don't have time to get into the laboratory, but there was a new one started in St. John. The big one was expanded again exponentially, and the number of tests went up hundreds of percent between 1920 and 1930. That explains it right there. Samples tested went from 732 to 11,411 in the 1920s. Milk testing, food sampling, all of them went up. Notre Dame went from 1,000 to 2,000 in 3 years. Those are not small amounts. That is a lot of testing, because a laboratory is an important part of any development of health. It's an important part. What happened? Just very briefly, as a result of all this, infectious diseases decreased tremendously, both deaths and anyone suffering from it. Survivorship and life expectancy rates increased. In fact, the life expectancy rate in Newfoundland in the 1920s increased faster than that in Canada. Mortality rates in St. John's dropped considerably in the 1920s, although in the rest of the island they didn't. In St. John's, probably because it was work done by the Child Welfare Association and the training, and the courses offered by for mothers. TB, the incidence of it dropped. Mental health treatment, excuse the spelling there, the actual per thousand was it between 21 and 30, the number of patients hospitalized increased from 325 to 508, and the hospitalization rate per 1,000 population increased from 1.4 to 1.75. I don't have to mention the hospital beds. I don't have to mention the Royal Commission report, but I will conclude in this somewhat truncated presentation, is that Newfoundland was undergoing a social, political, economic transformation during the 1920s. For many years, that was not properly identified, but now historians are challenging us to conceptualize the existence of basically an integrated health system in the 1920s, maybe rudimentary, but it had developed. And it was upon that foundation that the future was built. Frelin, Newfoundland historian, said that described changes in Newfoundland's healthcare in the 1920s as striking. I'll just leave it there. He recognized it. He was, again, the Clinch Professor of Medical History. So again, I'm sorry I had to rush it at the end, but there's just so much that can be said. I could have done this for 3 hours without any problem at all. Anyway, any questions?
I just want to say we are very tight on time here at the end of the evening, but I want to just say a big thank you to Pat for this talk. This has been an incredible trip through such layers of research. It's so evident. Just the data work, the archival work, it's really quite something. I think you've made a really fascinating, incredible argument here.
But have I convinced people that what I said was fact?
Well, on that note, we do have, I think, time for 1 or 2, and I'm going to check the online, but we are at 9, so I do want to be understanding the time. But again, I just want to say thank you to Pat, and I will take 1 or so question from the audience, and I'll check the online books. But again, we're a bit late. We did have one, I think, in the audience earlier. Yep. Wonderful. 1 second, I'll give you the microphone.
When you were reviewing the hospitals in St. John's, care homes, I I think there was a hospital or an institute for VD treatment in the Eskasoni.
Yeah,
Was that during that time?
that was during that. Eskasoni was a veterans hospital.
Yes, but then it became the VD hospital
Yeah,
in
for
the
VD.
20s or the 30s.
If you want to get treated for VD, you had to go down, I think, to Patrick Street, was it? And you had to go in under a covered area up in stairs up into for testing up to the second floor. It was really
And,
hidden.
and a follow-up question, was there a fever hospital on
Yes,
Signal Hill in
there
that
was.
same time period?
There was at one
there-
time, as a fever hospital in the area. If you stand on Signal Hill right now and you look down into the valley, there was a fever hospital there that they used to bring people in from the ships,
Yes.
put them in the fever hospital and let the ship come into the city, so
That's
the fever people wouldn't come into the city.
Yes, because I researched my wife's grandfather who was dropped off. Thank
Yep.
you for that, because
Yep.
he ended up in the fever hospital. I wondered why. Anyway, it was there as you came in,
That's correct.
because
And
it was scarlet fever. I think it was 1927, and he died there, and I found the record of it. But I
Yeah,
was just
they
wondering
burned-
about its
It burned
existence
down.
when you were going over to hospitals in the city.
The fever hospital in 1927 was the fever hospital on the grounds of the St. John's General at that time. The one in Signal Hill actually burned down, I think, quite a few years before, but it was used during the cholera outbreaks and things like this.
I also understand as well, thank you so much. It's always just understanding that landscape of health and how populated it was with institutions. It's really helpful and clarifying. I also understand as well to pay attention and to thank the folks who join us online is we did have, I think, a comment or a question or so, and I'm going to turn our tech help for the evening. Mr. Luke is going to read that for us, for Pat.
Yep, so this is from Heidi. It says, thanks for presenting your research. I'm wondering if you see a continuation or evolution of health services from the 1920s to the Commission of Government in terms of building what was established in the 1920s, specifically on Mosdell and his influence as Secretary of Public Health and Welfare under the Commission.
Yes, Mosdell, even when he resigned from the legislature in 1932, I think it was, or 33, he became the secretary of the new health, I'm not sure of the exact thing on the commission government, but he became the secretary. In that position, he had tremendous power on the development of what happened. But a lot of what he implemented and tried to implement came from the 1930 Royal Commission report, which was based on what was occurring in the late 1920s. So it was the foundation of a lot of what Mosdell did later on. And to a certain degree, I'm sure Heidi would agree with me that Mosdell was a father of health in certain ways in Newfoundland. But he's a forgotten person because I understand his house burned down and all his notes went with it. So no one ever did a history of him. He's in the book of Newfoundland, very interesting. But if you go to the archives, Board of Health archives, from 1924 on, right up, Mosdell's in everything. Everything that's done, Mosdell's in the middle of it. He died as a young, in 1941, and he's 61 years old when he died. But it's unfortunate we didn't have his records, his diaries, his letters, because he was a tremendous influence. But he was a very conservative man in certain ways. However, I don't know if I've answered your question, Heidi.
I think that's and one I think you have, in that you've really explained that continuity, that transition. And again, Pat, one of the things that I can't help but take away from this talk is, but you're right, we don't have as much of a collection for Mosdell as we'd like, but you found him. Right?
Oh, yeah.
You've read those annual reports, and as someone who's combed through the annual reports in education, everything attached to statutes, attached to, Hansards and things like that in those legislative records, this is where you find people. You find work that spans decades and had profound impact. And you've made I think, fascinating, complex, and a rich argument for that here tonight. And on that note, where it is also long the evening, I want to invite everyone to just give a round of thanks to Pat for this talk this evening.